Hello, everyone. Today we have a very interesting case. It's a rare disease, but it's important to know how to treat. Uh, this is a 17-year-old boy with past medical history of TIA 2 weeks ago and long-standing neuropathic pain in his extremities, who presents for evaluation of his chronic kidney disease. He was noted to have abnormal kidney function 6 months ago. He was also diagnosed with hypertension and is on lisinopril and aspirin. On physical examination, he is a thin male with normal development. Vital signs were normal, including his blood pressure was well controlled. Skin examination revealed multiple angiokeratomas around the umbilicus and on his thighs. Laboratory testing showed a serum creatinine of 3 and a BUN of 48, and this was consistent also with his lab about 6 months ago. Urine analysis showed plus 2 protein and some RBCs. Genetic testing and kidney biopsy confirmed the suspected diagnosis. And here is the kidney biopsy with hematoxylin and eosine. You see these abnormalities with vacuolization of the podocytes. And also you can see here in the other stain that this patient had darkly stained round inclusions in the podocyte, the red arrows, and also in the mesangial cells and endothelial cells. So yeah, the yellow arrow is the darkly stained round inclusion in mesangial cells. And in the endothelial cells, you'll see the same inclusions, the white arrow in the glomerulus. Also, there is an arteriole with Fabry inclusion bodies with the asterisks, and this is a toluidine blue stain. And on electron microscope, you can see the picture better now. There is inclusion-shaped multi-laminated myelin fibers, the red arrows, and zebra bodies, which is characteristics of Fabry disease in the yellow arrows. So there is zebra bodies in the podocytes. There is also smaller inclusion in the endothelial cells, the black arrow, and mesangial cells, the white arrow in the electron microscopy. So this is very typical for this rare disease. And now here is a question. Which of the following is the treatment of choice for this patient's renal disease? Dietary intervention, enzyme replacement therapy, pharmacological chaperone therapy, renal replacement therapy, or renal transplantation? And the right answer is renal transplantation. This patient has Fabry disease. It's very classic. The pathology and the history both are very characteristic. So this patient has combination of neuropathic pain, cerebrovascular accident with the TIA, cutaneous manifestations with this angiokeratomas, and renal dysfunction in young age with some proteinuria and hematuria. So that's very classic for Fabry's. And now, how would you like to treat this patient with advanced Fabry disease and with CKD stage 3B or 4, if you calculate his eGFR? So the standard therapy is enzyme replacement therapy, but also pharmacological chaperone has been used recently and very effective in early cases, but in these late cases with GFR of less than 60 or significant proteinuria more than 1 gram, the diagnosis is dismal, and this patient would benefit better from renal transplantation. So the patient survival on after kidney transplantation is superior to dialysis, and the European Renal Best Practice Guidelines recommends against starting enzyme replacement therapy in patients with proteinuria more than a gram or EGFR less than 60. So that's too advanced now, and the patient is less likely to benefit. This recommendation is mainly based on multiple different trials showing no significant clinical benefit with enzyme replacement therapy in these patients. The enzyme replacement therapy may still be used in this patient to treat extrarenal manifestation like neuropathic pain, but from the renal standpoint, this patient need kidney transplantation, preemptive kidney transplantation. And here are the references. And thank you so much and have a good rest of your day.